When does a trainee become a trainee in difficulty?
When you have a trainee who is in difficulty, you often get an overwhelming impression that things aren't going quite right, and it's sometimes difficult to put your thumb on exactly what it is that isn't right. So it's useful to try and do that, to try and diagnose what the difficulty is. There are many ways of doing that. One model, which was put forward by an occupational psychologist called Tim Norfolk, suggests that you might want to look at it in relation to 4 domains. So relationships with patients, relationships with staff, diagnosis. Are they able to make diagnoses as you would expect them to at the stage of their training? Management, clinical management, and then professionalism, which encompasses things like punctuality and attitude generally.
Some of the symptoms can be related to knowledge, some to behaviour and some related to health. Often the trainee can have symptoms that relate to all 3.
There are numerous examples. Behaviour type issues can be to do with punctuality, can be to do with being emotionally labile and therefore running into problems with the practice team or the patients. It can be to do with not cooperating with, say, practice agreed policies and procedures. Health-related issues can certainly affect performance at work. Sometimes, unfortunately, exam failure can be the first sign that somebody's had that actually a person's been struggling for a long time.
So an educational supervisor is expected to diagnose the trainee in difficulty as early on as possible, to provide feedback, to provide support, which is an important facet of it, to agree a learning plan which can be carried forward to try and address some of the difficulties, and to escalate it if necessary and appropriate, but involving the trainee at all these stages.
Sometimes trainers instinctively know that their learner just doesn't look well, doesn't behave as somebody who's feeling well, and gets an inkling that there's a problem. Again, sensitively, they often ask the learner if there's something going on, and if the learner's willing to open up, then that often helps, but that's not always the case.
Before you can give feedback to the trainee in difficulty, you need to be clear about why they're in difficulty. So you need to consider why it is that they're having problems with their relationships, why it is that they're constantly late, why it is that they're unable to keep contemporaneous notes. And there may be a variety of reasons. It may be a skills or knowledge problem. It may be that something's going on with their life. And being curious about that and asking gently if there is anything else going on can be quite important. For example, have they just had a baby? Is there a lot of stress at home? Are there other external factors which are influencing how they're able to function in the workplace?
Sometimes learners can actually conceal health-related issues, and then it can come to light in a far more dramatic way, which we've occasionally had with serious incidents occurring.
Other factors which could contribute are more personality factors. And again, although it's harder to modify those, there are things you can do. For example, trying to match the learning style. If your learning style isn't matching your trainees, then adapting so that they're able to learn better.
What resources are out there to help trainees in difficulty?
It can vary a little as to whether they're based in hospital general practice at the time, but there are overarching supports that cover both. So the clinical supervisor, whether it be in the hospital or as a GP trainer, often is the first person to have a feeling there's an issue. They would then be able to discuss with the educational supervisor, who may be the GP programme director, who sees them in a different scenario on the VTS half-day release, and often in a more relaxed setting where they're amongst their peer group, and that can be very revealing. Then, so often those two would have a conversation and engaging the learner with that conversation.
It's very important to keep adequate documentation. One way of doing this is through educators' notes on the e-portfolio. These notes should be objective and brief, just highlighting the gist of the concern. And you should be quite transparent with the trainee that this is what you're going to do, so that there aren't any surprises.
If it's felt that the problem is more serious, then the patch associate director in general practice would be involved and asked to have a joint meeting. And we've then got trainee and difficulty ADs, so like myself, that they can link to. And we often then ask that the local team have tried to do, if you like, a diagnostic workup of whether the issues are sort of health, behaviour, knowledge, and a provisional plan. And then we look at that with them and either bring in extra specialist resources or to just agree the plan, continue and to monitor it.
Initially, when there are difficulties, it would be rather unfair to escalate them immediately. Still useful to keep a record with educators' notes, for example. But having this discussion with the trainee where you give feedback, try and keep it descriptive and specific. So talk about specific behaviours or specific incidents rather than trying to extrapolate it to them as a person. So I think that helps in discussing why these issues are happening and what it is about the workplace, what it is about what's going on with them, which are causing these problems. And I think if it's not resolving in a timely way, then that's when you involve other people.
The professional support unit have a range of different courses and supervision. We've got a complex cases unit within the GP school that helps and observes and advises on cases. We've also got psychological support from MedNet at the Tavistock or Practitioner Health Programme. And we've got availability of dyslexia assessments, particularly relevant for people failing some assessments like AKT, which is a multiple choice exam.
So in summary, if you have got a trainee who isn't progressing as you would expect them to, have a look and see in which domain they're having the difficulty, whether it is with the relationships, with the clinical diagnosis or management, or with professionalism, and then try and understand in collaboration with the trainee why this is happening. Whether it is largely skills and knowledge, whether there's other external factors happening in the trainee's life which are influencing their performance, whether it's more of an attitudinal issue, and try in a collaborative way to work out learning objectives, ways in which to address these difficulties, document your concerns through educators' notes if possible, and escalate appropriately.
Here are some questions that are intended to get you thinking about this subject in greater depth. What are the strengths and weaknesses of the Norfolk framework? Think of a time when you yourself had problems as a learner. What would someone else have noticed about you? And what were the underlying reasons for your difficulties? In part 2 of this programme, there's a discussion of a specific example exploring how Norfolk's model can be applied in practice. If you're a student on our postgraduate certificate course, you'll find references and suggestions for additional reading within the online resource folder.